Good morning. We're going to talk briefly about different patient care areas. And some of my colleagues are going to talk about some new service lines that we have not shared with you. Most of the service lines that are in this slide, actually, we have shared with you, so I'm not going to go into any detail, other than to say we really are looking at having some of these service lines being reviewed and overseen by outside entities that can come into the hospital and look at the quality of care and show opportunity for improvement. So as you can see, we have 6 different lines that, and this is a volunteer. We asked the Joint Commission to come to the hospital and look at this. So the challenge is not just to set this up, but to keep it, because they keep coming every 2 years. And they request random charts, and they look at numbers, and they say, okay, yes, we continue to make you accredited for these programs. And I was looking yesterday at the Joint Commission website and kind of exploring all the hospitals in Riverside County, and I found that there is no hospital that has 6 of these particular things being reviewed by the Joint Commission, because again, it's a volunteer process and it costs a little bit, but it's money well spent. And actually today, the Joint Commission is at our hospital, looking at one additional wound care inside the hospital. So we're going to expand this list. And then finally, in relation to the American College of Surgeons, we have talked enough about level 1 trauma because we have been very proud, so I'm not going to talk about that. But the Emergency General Surgery Program is a completely new program that has been started by the American College, where now they come and review what is the quality of care and complications that you have in emergency surgery. Somebody comes with an acute appendicitis, or acute gallbladder problem, or a perforated ulcer, or any emergency type of surgery. And we were fortunate to be the first hospital that achieved that accreditation for the American College. They asked for some hospitals to be a pilot, and we were selected as one, probably because we also had Dr. Coimbra that helped with the college in developing this program. And now there is a significant number of hospitals that are requesting the college to come to that. So these are some of the programs, and Dr. Kim is going to share about some other exciting new programs that we have not shared with you.
Hi, Board of Supervisors. Thank you for having us, and thank you for your support over the years of our hospital and our department. So I'm here, to talk about our gastroenterology department. So very proud about the progress that has happened in that area. One of the mantras that they go by is operation, tech, and service equals access. And you'll see how that sort of comes out in what has been happening over the last 2 years, even despite the pandemic that has really adversely affected a lot of our care in that area. But largely I have to thank the gastroenterology department under new leadership of Dr. Sorrell, and the team and the transformation that he's really been able to do over the last 2 years. He started by coming and streamlining our operations, and utilization of gastroenterology rooms, and what that's led to is basically a doubling of the number of procedures that they're doing, over year on year. He added further things like Provision Apex. He introduced new and really advanced procedures for gastroenterology that you can't get at every hospital, things like capsule endoscopy. They have pH monitoring. They have increased our access for patients to gastroenterology appointments by using physician assistants. And then even this year, he's introduced new service lines within gastroenterology like manometry, the smart pill, a thing called double balloon enteroscopy, which is a very advanced procedure that most places can't do. We have a full-time now inflammatory bowel disease program that is starting up. And then he also brought in Dr. Sukareja, who is a pancreatobiliary expert, and he's probably in the top 5% of the nation with the kinds of procedures he can do and the type of advanced procedures he can do. And so this is going to really help our patients and help our services at our hospital. So even, what you can see here is basically our clinic visits increasing about 38% from 20 to 21, and another 12% increase over this upcoming year. And so, what this means for patients is basically he's taken down our backlog of patients waiting in the queue, which to get a GI appointment in the county of Riverside can take somewhere between 7 months to a year. And he's really reduced it in our hospital down to about 1 month. And that's a huge increase. Our backlog of colonoscopies used to be at about 2,500, which would take about 10 months to do, and now it's down to probably about 50. Or 500, I should say, sorry, I missed a zero there, but, it's about an 80% decrease in that. So, really with the program that they've kind of improved on over the past 2 years, despite COVID, it's really improved our access to patient care. Right now, Dr. Serrao is also going out to neighboring hospitals and telling them what kind of great things that we can do now that we couldn't even do 2 years ago, and is, bringing patients that need those kind of specialized services from outlying hospitals to our hospital. So, it's been a really great, partnership. We appreciate the support. The downstream benefit is hopefully they're going to prevent a lot of disease and a lot of late-stage disease that we're going to see. It's going to also increase our surgery programs because we're going to be detecting more disease and be able to act sooner. And overall, it's just going to really improve the access to our community that's really been hurting for so many years. So thank you again for your support.
Thank you. Any questions? Yes, Supervisor Speaker.
I have to ask this. What is the smart pill? Everything else kind of made sense, but I couldn't figure out what the smart pill.
That might be a little bit above my pay grade too, but it's one of those pills you swallow with a camera.
Oh.
And it can take pictures as it's going down and through, and can basically tell you what is going on in the far reaches of your bowels, if I can say that, and discover areas that you can't reach with a scope.
Wow.
So
Wow. Can you buy those at Walgreens?
it's coming soon, probably.
That's fantastic. And of course, so many with colon cancer and pancreatic cancer and all those other diseases that just seem to be coming out of everywhere. Getting it early gives the patients a much greater chance of success.
Right. Absolutely.
And I just want to thank you for that timeline. I sit on the IEHP board, and that's one of the things that our members complain about is how long it takes to have procedures done.
Absolutely.
So I'm sure that every hospital has that. And to just reduce this as dramatically as you did is such a wonderful advantage that our patients at our UHS would have.
Right. And we're just at the beginning. It's going to get better. It's just going to get better.
So thank you.
Well, that's exciting. Thank you.
Thank you.